Hello, everyone. Josh and I, well, we'd like to give you something for free.
That's right. We've got a brand new book coming out. It's called Love People, Use Things. It comes out July 13th. But if you pre-order it by June 1st, you get the free Love People Companion Workbook. Head on over to lovepeopleusethings.net to find all the details.
The Minimalists.
I was wondering if you have a minimalist philosophy on insurance, specifically health insurance. I'm at a point with a new job where I'm having to choose whether I want to get it or not. And it seems like a just in case type of thing because I'm not anticipating any major medical issues. But it does kind of feel like it'd be the smarter option to get it. But I was wondering if you guys had any insight or tips to navigating insurance. And if you do, I'd love to hear it.
So, Ryan, I'm told that Meredith's question is one of a dozen or so people who called in with a very similar question, which means thousands of people are actually thinking this question if a lot of people are calling in with the same question.
It's a very valid question. I was just talking with a friend this week about them retiring, and their job is stressing them out a ton. And he's an older gentleman, past 65, and I'm like, why are you still working? Like, are you like not set up for retirement? He's like, no, actually, like I was talking to my finance guy, and I've got plenty of money in retirement. He said something about like he could, set up to where he could get like 6 figures a year in retirement before taxes. I think. But regardless, I'm like, dude, so you're set up, man. Like, you can totally retire. What is holding you back? And he's like, well, I've got insurance for me and my wife. And I'm worried that, next year, I know my wife has got some stuff coming up, and I don't want to have to, put that, pay for that out of pocket. I'm like, well, how much is your insurance? Like, how much would it be? He's like, oh, it's probably about $1,500 a month.
Wow.
I'm like, so it's $18,000 a year for you to do this. You're telling me that your finance guy is telling you have access to about 6 figures a year, and $18,000 is what is holding you back. So I know that this is kind of an anomaly. It's an exception, but it's just interesting how that $1,500 a month, which he could very easily afford, it's still preventing him from doing what he knows he needs to do.
Yeah, I think sometimes the narrative we tell ourselves about why we're staying behind is only the narrative, and it may not be the complete picture.
Yeah.
The fear, we need to put some sort of label on the fear. I'm afraid of leaving. I'm afraid of failing. And so the easiest thing for me to say is the societal acceptable thing. It's healthcare. Because we can all acknowledge that our healthcare system in the United States of America is broken.
You mean our sick care system?
Yeah, yeah. And by the way, we don't focus on well-being. We don't actually focus on health. The majority of us now have chronic illnesses. There are a litany of reasons that exists. But be that as it may, we are here right now. And what we're recognizing is, there's a problem with our healthcare system. But that doesn't have to be, as Ryan, you've alluded to, that doesn't have to be the reason that we stay behind and stay miserable.
Yeah.
And so maybe if we posit it in a different way, I'm staying miserable so that I can pay for my health insurance. Mm-hmm. Well, maybe there's a different way. And that different way quite often is, how much is it going to cost me? Because this ultimately just becomes part of my budget. When you and I walked away from the corporate world, it was like, okay, our insurance is about $350 a month, right? Mm-hmm. Well, that's just part of my every month budget. It's there with rent and utilities and now health insurance. Now, Jack, Patreon doesn't give us health insurance, do they? Maybe am I missing out on something here?
Not yet.
Do you guys do?
Uh-oh.
Oh, wow.
The fact that benefits are tied to the employer right now.
Yeah.
And what that means for this emerging creative class who doesn't have a traditional employer.
Yeah. Yes.
That's got to be fixed.
Right.
It will be fixed.
Yeah.
Somebody's going to fix that because it's nonsense.
Yeah.
Yes.
It is.
Yeah.
So maybe Patreon is going to be the place where creatives can go to get their benefits.
Get insurance.
In the meantime, I think what we need to understand, Meredith, if I look at your question here, and what you're really saying is, how do I navigate this complex world of insurance? It's overwhelming.
Yeah.
And it's not overwhelming for you right now because mommy and daddy, the employer, they take care of it for you, right?
Yeah.
And And so, do you need it? She's also asking, is it a just-in-case item, or is it a just-for-when item, or an emergency item? Let's talk. So we have these 16 rules for living with less. And I just mentioned 3 of them there. One is just-in-case items. We call it the 20/20 rule. Anything I'm holding on to just in case, all those cables are sitting in your junk drawer, you can replace for less than $20 in less than 20 minutes wherever you are. And that frees up space to get rid of tens of thousands of just-in-case items. The good news is you never have to use the rule. All those things we're holding on to just in case, we never ever use. Right. And because you have a studio. And so there's a lot of just-in-case items there. You're like, wow, this is from 1993, and it's been sitting here ever since. Now, there are these just-in-case items that Ryan and I say, okay, it does make sense to hold on to. They're emergency items.
Yeah.
They're the just-in-case items you hope you never, ever have to use. My first aid kit is a just-in-case item, but it's an emergency item. The spare tire on my car, I don't want to use it, but it's there just in case I absolutely need it. So emergency items are the sort of one subset of just-in-case items we set aside. We call it the emergency item rule. And then there are these other things that are just for when items. I think health insurance is sort of a combination, depending on your health status. It's either an emergency item where you're like, okay, I have that in case some sort of catastrophe happens, right? And then I will have access to health care. Then you just have catastrophic coverage. That's what Ryan and I have. And so if some sort of catastrophe happens, I end up in the emergency room, something's broken, whatever, I can handle it. Very high deductible. Now, there could be a case where there's just for when, if you are a type 1 diabetic, for example, you need medication every month, then you need insurance just for when, or you're going to be paying out of pocket every single month. Yeah. Either way, that needs to become part of the budgeting. And yes, I think our system and our costs are skyrocketing. They're out of control. Medical debt is responsible for more people being financially bankrupt than just about anything else at this point. Yeah. It's a huge problem. But in order for it to not be a problem in our own lives, it just becomes part of our budget. So we understand that if I'm a business owner, if I'm a creator, and I want health insurance, well, then I'm going to have to plan for that, just like I'm going to plan for rent or whatever other expenses I have in my life.
Yeah. It's so funny. I'm like thinking of a few different solutions to people who need insurance who can't afford to pay for it outright on their own every month. Like one thing I'm thinking about is I know that let's say you go to the emergency room, like you God forbid you have an emergency, you don't have insurance, you go there, you get this huge ER bill. If you don't have the income, there's a certain level of income. If you don't make that, that will get subsidized. I'm not encouraging people to go and take advantage of, of subsidizing your medical bills. I mean, that's not what I'm saying, but there are options for emergency type situations like that. Another thing too, like I asked my friend who I was having this conversation with about retirement, and I'm like, dude, how much a year would you pay to not have this stress? Like, is it worth the $18,000 a year? And he's like, yeah, like you put it that way, like I would definitely, as long as you can afford it. So yeah, I mean, ask yourself, Meredith, like what is it worth for you to go out on your own? If you have to pay an extra $300 a month for your insurance, it's a lot of money, but maybe it's worth taking that stress away. Another thing I was thinking too is like there's Medicare, right? I mean, it's not the best insurance in the world, but it is. Is it Medicare or Medicaid? Medicare, right?
Medicaid's if you're over 65, I believe.
Right. Yeah. So Medicare. I mean, I know people. I have friends who are starving artists, and that's what they're on. No, it's not the best option for insurance. It's not this Cadillac insurance, but when they get sick, they have something to fall back on. So it's not, I just don't want Meredith here to feel completely hopeless. I mean, there are some things that, maybe it's not as good as the insurance you have right now, but there certainly are options that you can look at outside of, what your employer pays for you.
It seems like maybe there's a difference with between just in case items. The difference between a cable, and health insurance is that the risk associated with not having a cable when you need it is very small.
Yes. Right.
The risk associated with not having health insurance when you need it could be catastrophic.
And that's why it's an emergency item,
yes,
right?
Okay.
And that's why I look at it as one of those things that is absolutely necessary. And in fact, what I will tell you is that because of Patreon, and we've found a number that works for us monetarily, we're going to make sure. So we see Sean and Jordan here. We also have Jess on our team. We're going to make sure everyone has health insurance once we reach a certain number of patrons, so that we can afford to pay for health insurance for everyone on the team as well.
Pamplemousse is actually doing that right now.
That's awesome.
We're just going through health benefits.
Very cool.
Yeah.
That's beautiful. So giving Patreon is in a way giving us the opportunity, keeping the podcast 100% advertisement free, but still being able to, we always joke that this episode of The Minimalists is brought to you by nobody because advertisements suck, but the truth is it's brought to you by you, patrons, and it's brought to everyone by the few people who are willing to support. And I know Podcast Sean and his entire family, he has, 13 kids or something. Who knows how many kids Jordan has?
He doesn't even know.
Yeah. He claims none on his taxes. But,
Right.
But yeah, what we've learned is like, hey, we want to be able to provide that as well as a sort of benefit to the team, to say thank you. So thank you to the patrons for supporting us and providing that as well.
Amen.
It's amazing.
Such a beautiful thing.
Did you enjoy this video? If so, you can listen to full episodes of the Minimalists Private Podcast, available exclusively on Patreon. Visit patreon.com/theminimalists today. Your support keeps our podcast and YouTube channel 100% advertisement free.